How you doing?
Good. Another week.
Yes, another week, another gorgeous weekend. So let's get going. A lot of questions people are asking. You've been on kind of the legacy TV news stations talking about outdoor amenities and kind of fighting for everybody to get a getting out there. Do you just throw your hands up in the air and just kind of say, "Hey, what's going on?"
No, I like to be dogged and persistent, and it took us a while to get more testing, and we kept on it, and we got it. It took us a while to get isolation centers, and we were persistent and dogged, and we got it. We wanted more vaccines. We wanted to have a focus on hotspots. We were persistent and dogged, and we got it. Now
Yeah.
I'm pushing on outdoor amenities, and I don't take the initial refusal and walk away. I believe the arguments are on our side. The physicians are on our side. The science is on our side. The data is on our side. And it's good for people's physical health, mental health. So I'm going to keep pushing until we see these unwarranted rules and outdoor amenities lifted.
Do you think that they'll be lifted before the June 2nd stay-at-home order expiration?
Well, we'll see. But I'm going to keep pushing. I really believe that there is a cost to people's physical health and mental health when you have outdoor amenities closed. We're the only jurisdiction in North America that is closing outdoor amenities. All the science, all the data says that outdoor transmission is very rare. And so the fact that we're inconsistent with science, inconsistent with the medical advice, is something that needs to be rectified as soon as possible.
Let me ask this. If Brampton, as a municipality, decided to open all their outdoor amenities against the province's orders, what would happen to Brampton?
So there's fines that could be up to $1 million per amenity. And then because we're a corporation, it could be up to 10 million for multiple offenses. And so there'd be huge penalties. Municipalities are creatures of the province and have to abide by provincial legislation. So it's not as simple as saying we're going to ignore the provincial emergency orders. Municipalities legally have to comply.
Okay. Can I just ask, when do you see yourself on a patio legally?
Well, once again, outdoor transmission is very rare. And we've seen the CDC say that. We've seen all our top doctors say that. So hopefully soon. I see a summer with patios. I see a summer with outdoor amenities. I'm hoping that this final 2 weeks of an extended lockdown are just that, the final two.
How about indoor dining? When do you see yourself going into a restaurant?
Well, ultimately, these are decisions that will be made by the provincial science table and the premier. But if you look at the UK, you look at other countries in the world, when you get a certain level of vaccinations, it really opens the door for getting back to normal. Joe
Sure.
Biden was in the US talking about fully vaccinated people can be indoors together without masks. So we're going to get to that threshold soon. They're saying that by June 1st, we could be over 70% vaccinated in Peel. And that certainly opens the door for the relaxing of provisions, both indoors and outdoors.
June 2nd, do you see Brampton going into gray zone?
Well, they keep on changing the color-coded zone. So I'm not sure what color code they'll announce on June 2nd. They've said they want to see case counts below 1,000. We're seeing a positive trend line right now, today down to 2,600. So I'm hopeful that we're going to continue to see this positive downward trend.
I've seen you on TV stations about airports. What can be done by you to close these airports?
Well, ultimately, that will be a federal decision. And once again, I'm sticking to what the medical advice is and the science advice. Dr. Lowe said he's concerned about variants. A number of our top infectious disease doctors say that variants are a concern. And I know the federal talking point is that only 2% of the cases come from travel, but those 2% can turn into thousands because one variant turns into thousands. And the best example is the UK variant. That's now the dominant form of transmission. It started with one case. And it has huge repercussions. You look at the long-term care home in Barrie that got hits, over 70 fatalities because of the UK variant. So we do need to have stricter border provisions. I'm not saying permanently. I'm just saying for a few more weeks until we get out of the stay-at-home order, until we get a handle of our healthcare capacity. And I know they're saying that they canceled direct flights to India, But I challenge anyone to go online and Google flights. You can fly anywhere you want. They simply make it a non-direct route. Get onto Google, it's as easy as that, and you tell me if the federal provisions are adequate. Literally, I had someone yesterday tell me they're going to visit their father in Vietnam, and they can book a flight just like that. I've seen people on Facebook down in the US. It's happening. Let's not be naive about it. International travel is happening. Interprovincial travel is happening, and it spreads variants.
Do you think the India flight ban will be extended?
Well, they don't really have a ban. You can do non-direct flights to India. It was just for show.
True. The CNE has been canceled, unfortunately, for the second straight year. Do you see like Brampton events being canceled this year, like fully?
Well, those are discussions we're having now. I think it's premature to make that announcement, but we'll see. All right.
There was a huge party in Toronto last week, $13,000 worth of booze being confiscated. And I know Brampton had this issue a while back when the pandemic first started. Have you seen any big parties in Brampton or anything recently?
We've seen a high level of compliance. We had a birthday party with 30 people a few weeks ago where there were some fines and charges laid. But overall, there's been a high level of compliance. I think the public understands how serious this is.
Okay. Peel and Toronto were allocated 50% of the vaccines in Ontario. That expires next week. Are you worried that Mississauga and Peel and Brampton will not get their fair share of doses?
So right now we have a commitment until May 21st for the higher allocation of doses. You have to put the fire out where the fire's happening. You need to have a focus on hotspots. So I'm hopeful that the province will consider extending it beyond May 21st. I think that is strategic, that's sophisticated, and that helps, limit the spread. But we'll see where we are at on May 21st.
Okay. Do you know if the second dose will be moved up?
We're hearing there's talk about that as Canada gets more vaccine supply, but there's no commitments on that yet.
Okay. Another vaccine question here. The province announced 12 to 17 will be vaccinated starting in June. Can we see that sooner in Peel?
They haven't given us that indication, but I'm hopeful that we'll see. The sooner we get to herd immunity, the more people we have vaccinated, the better we're going to be to get out of this. So the sooner that happens is welcome news for me. I'm hearing it's going to be probably 2 to 3 weeks away.
2 to 3 weeks, okay. This is a question we get a lot of people that have been vaccinated. You've been vaccinated, I've been vaccinated. Could we hang out? Could people that have been, first doses, kind of 2 weeks in, could we hang out?
That's not something that the provincial emergency orders allow at this point.
Okay. And, there's a big vaccine rave party going on this weekend. Are you going to be there?
Doses after dark. Well, I've been vaccinated, so I won't be there, but it's pretty neat. They're doing 24/7 vaccines. You can go at any hour. Great for shift work.
You've frozen up, Mayor Brown. You there? Hello? You might have got a phone call. Mayor Brown? Yeah, we lost Mayor Brown. Let's see if he's there still. Well, we lost Mayor Brown. I was at the second last question. Let's see. No, he's still not there. Well, thank you very much, Mayor Brown. Little tech issues, but we'll get you back next week. Thanks for being on. I hope everybody has a good weekend. Take care.